Good morning. Thank you to the Florida Orthopaedic Society for letting me be here and present this abstract. And I also want to thank Dr. McMillan in the back, as well as Brian Conrad, who's not here today, for their help in making this project possible. So a little background. Spinal interbody fusion is a very common procedure. It's performed for a variety of indications. There's currently numerous graft options available as well. The graft's main function is to support the interbody space mechanically while awaiting bony fusion to occur, and therefore it needs to be mechanically sound. It needs to have a sufficient size to restore disc space height, and ideally have osteoinductive, osteoconductive, or a combination of these properties. Despite being variable as far as the amount of interbody grafts available, there's numerous problems with the grafts. Obviously, harvesting autograft is not a benign process. Cancellous graft has poor compressive strength traditionally and causes graft subsidence. Metal artifact plays a detrimental role in trying to interpret imaging studies with metal cages, and even the PEEK cages and carbon fiber cages remain as permanent foreign bodies. One thing that's often overlooked is that in order to implant an interbody device of reasonable size, the nerve roots have to be retracted substantially, and this can lead to iatrogenic nerve root injury as well. The main objectives of our study were, first, to evaluate mechanical properties of granular, cancellous, and cortical bone impacted into a mesh container to see if it can withstand the compressive forces across the interbody space. Additionally, we looked at augmenting this implant with a flowable ceramic to see if this enhanced the mechanical properties. We used OptiMesh from Spinology, which is a deployable mesh pouch that can be implanted empty into a skeletal defect and then expanded by impacting granular bone. Its intended use is within a vertebral body itself, but it's currently being investigated for use as an interbody implant, and it can be implanted in a minimally invasive means. Cermamic's an injectable biphasic ceramic out of Sweden. It's composed of calcium sulfate and hydroxyapatite. The calcium sulfate is biocompatible, and it's absorbed over weeks and months after surgery, whereas the hydroxyapatite remains as more of a long-term osteoconductive scaffold. The granular bone graft from MTF consists of demineralized and non-demineralized bone. It's both cortical and cancellous bone with hyaluronic acid as a carrier. And Spinology provided us the instrumentation for assembling and preparing our grafts within a simulated interbody space, which we made here, and that's represented by the jig. 3 experimental groups consisting of the first being bone alone, bone plus the ceramic, which was half filled with each, and then the cerament alone. And 5 specimens from each group were prepared for mechanical testing. The testing was done on the MTS machine. Initially, the specimens underwent cyclic loading for 1,000 cycles between 40 and 400 newtons, after which they were loaded to failure with the max compressive rate of the MTS machine at 4,000 newtons. We calculated the stiffness, the displacement at first cycle, and ultimate displacement, along with the displacement allowed at failure, cyclic creep, and energy absorbed. So all of our implants withstood load to failure up to 4,000 newtons. There was no fracture of any of the implants that involved the ceramic, and there were no ruptures of the OptiMesh bags for any of the components. Clearly, the ceramic was extremely stiff compared to the other 2 implants, both of which performed somewhat equivalently. It follows, therefore, because the ceramic was so brittle, it absorbed very little energy prior to loading to failure, and the bone and bone plus ceramic, again, compared very equivalently. Interestingly, the bone displaced the most during the first cycle. However, this time the bone plus ceramic outperformed the bone alone, and then ceramic, again, being the stiffest of all the constructs, had very little displacement at the first cycle. This same trend held for displacement at max compression. And then lastly, during the cyclic testing, clearly the ceramic, being extremely stiff, had very little creep. The bone and the bone plus ceramic performed almost equivalently again. So the question becomes, what are physiologic loads across the disc space? And the numbers in the literature are widely variable. Many of these are baboon studies when we're looking at in vivo measurements, and they're all highly dependent on how the measurements are made and in what position the subject is sitting or standing in. The compressive loads from mechanical studies across the disc space are suggested to be anywhere from 400 to 1,400 newtons in a 70-kilogram subject. And then other studies that report on activities of daily living show a range from about 90 to 2,500. So based on this and our mechanical testing results, we conclude that the cancellous bone graft alone within the mesh container is mechanically sound and strong enough to withstand the expected compressive forces across the disc space. This in and of itself might allow for a nearly largely cancellous graft option to serve as an interbody fusion device. The addition of the ceramic clearly enhanced the mechanical performance, and it leads to the thought that perhaps this hybrid implant with both the bone and ceramic would be a great alternative. The bone would have osteoinductive properties that would be important, whereas the ceramic would have the osteoconductive scaffold that would remain more long-term. Clearly, further investigation is warranted. It looked good in the lab, but we need clinical studies to see how this would perform from a fusion standpoint and to see if the ability to introduce this minimally invasively within the interbody space and then expand it to a sizable implant would help with decreasing iatrogenic nerve root injury. These are my disclosures. Spinology and bone support were very generous in providing us with materials to perform this study. Thank you.